here.
Hi, my name's Charles. I'm here for 3 weeks at Waterloo Sports Medicine and I'll be working with Dr. Lee. I'm from the University of Ottawa. I went and did my undergrad at the University of Waterloo and I was born and raised in Kitchener, Ontario.
And are you like interested? This is me. This is Dr. Lee. I'm off camera. Actually right here. Yeah, what's your interest? Do you have an interest in sports medicine?
Absolutely. I played sports my whole life. I've been here before as a patient and I'm always interested to see what they're doing behind those closed doors.
All right, let's see. All right, we got the selfie going here. I've never done this before. I know. I think I've done this before. So hopefully over the next few weeks we'll get you to become like a sports medicine expert. How's that sound?
Maybe just a beginner would be a good start for me.
All right. So let's go. Should we tour the clinic?
Sure.
All right, let's go in the clinic. We'll give a tour of the clinic here. Go ahead. So here we are in the clinic here. Front desk is over here, and we'll come by first of all down the hallway.
Yes. Yes. Sorry.
Come down over here. Go down over here, see what we got down into the exam room. So this is where I look here. So here we are, sort of in my exam room here. Just come back over here, and we'll come down the hallway here. It's my back office. Down this hallway here. So this is our video room here. So what happens here is we have a bunch of equipment here. We have computers and cameras, and we have this editing software where we can make our videos. So when you see this video made, it'll be made in this room here in the clinic. This is how we make our professional looking videos.
It's a mechanical problem?
And actually here, you can want to be the camera guy?
Sure.
Just hold this and you can follow me around here. Give a quick tour. Going to the physio area here. This is our physio clinic here. So as you can see, it's a pretty big clinic. Let me show this area here. One of the unique parts about this clinic, from a sports medicine point of view, is that we have a big, sort of get the whole net here. So we have a big net, and what's the purpose of the net? We came up with this idea 10, 15 years ago, because really, if you think of what sports medicine is, I see sports medicine as essentially occupational medicine for athletes, if you think of it in the pure sense. So if an athlete has a sore knee, sore wrist, let's say they're trying to hit golf balls or throw baseballs, then if you think of it in a true sports medicine setting, a doctor or physio should be able to actually watch them hit a golf ball, throw a baseball in the element. In a workplace situation, a lot of physio clinics will have work hardening stations set up where patients with back pain can lift, boxes with weights up onto a shelf. So not very many sports medicine clinics has a setup where you can literally hit a golf ball into a net. So what I'm going to do is, seeing how I think that Charles is a better athlete than me and younger, so I'm not going to demonstrate hitting a golf ball. Pick up a random club here. What is it, lefty?
Very fun.
Like me. Good one. Good shot.
Nice.
All right. Hit another one. Let me get the angle from here. And we actually use this sometimes to look at biomechanics, look at patients, how they swing, look at the... Good job. Okay, so let's put that little mat away. And I'll tell you about the... So, if you have, bad elbow or shoulder, one of the things we can do is look at your biomechanics of throwing pitching motion. So go ahead and throw a baseball. So you can throw baseballs. All right, is there a football you can toss or a rugby ball you can throw? Do you know how to properly throw a rugby ball, like underhand? Good. What else we got there?
Got a few
Soccer ball?
Soccer ball. Got volleyball.
Good. Good. Here, take that. Okay. Well, we don't have to do that. Is there a baseball? Does this tee work? I'm not here. Take this little tee. Good job. Okay. All right. So it gives you an idea of what kind of functional rehab. So Charlie, what do you think of this room here?
Pretty neat.
Do you think it would help?
Yes.
How? How would it help me as a sports doctor or help you if you were a sports doctor?
A lot of sports injuries are a lot of repetitive strain, and it can really help you correct any abnormal movements you see, any really chronic strain patterns that you're really seeing.
So you can see how in a sports medicine setting, for overuse injuries, if you don't fix how someone plays their sport, let's say I play tennis, so I'll see a tennis player, they have tennis elbow, common problem.
Right.
All the physio, all the cortisone shots, all the rehab, all the bracing in the world is not going to get their tennis elbow better if they're hitting crappy backhands.
Right.
So I'd say you need to take a tennis lesson. And that'll help, and we can do some physio and do some treatment too.
Right.
I think that applies to other sports, repetitive sports. I think golf would be a perfect example.
For sure.
You take a golf lesson, baseball, throwing.
Yep.
You're a hockey player. I think you told me you love hockey. You grew up playing hockey.
Yep.
Would the same apply in hockey?
I don't find it as much as I found in baseball, but I definitely can see that happening.
Give me an example of how taking a lesson or seeing a hockey coach would help if you're doing something incorrectly? What do you mean?
Yeah, I think just when you're taking your shot in general, if you're using too much of your arms and not enough of your hips or transferring your weight properly, doing that at a competitive level will definitely cause strain on the arms.
Here, I have an idea here. I think I can do this. Let's see. Here. See this thing here? Just that slider board. Put it down there. And found a puck?
Yeah.
Okay, so show me what you mean in terms of what someone would do incorrectly that would cause something to hurt. I don't know.
Sure.
Shoulder, arm, elbow. Yeah.
So if you're just having a stiff right arm and you're not using any of your weight to transfer it, and you're taking your shot, you're going to be using all that power in your arm, and that works if you play at a recreational level like myself. But when you're doing that daily, you're going to build up strain in your arm and you're going to be sore.
Okay, so why don't you, I don't know, maybe demonstrate some incorrect or not the best way of taking a shot or something like that. And what are you trying, show me, tell me something that's bad. What are you going to do that's bad?
So my upper hand here is fully extended here, and if I just leave it that way throughout my shot, it's fine for a shot or two, but after 1,000, you can see how things like baseball and tennis, easy to appreciate that, but in hockey, you do that, your shot's fine, but your arm isn't.
Okay, so now show me how, like if you were a pro, what you do differently.
Well, what a pro would do, and not myself, they have a little bit more flexion in their arm, they're still keeping their stick square there, and they're using a little more in their hips as they are instead of their arms.
Is that your pro shot?
My pro shot? Yeah.
Okay.